Good morning and welcome to the January 12th and 13th resident and staff Let's Talk. Combining the two because this is an important topic and we want to make sure it gets out to everybody. So hopefully all of you are aware we did our first dose of the vaccine on Monday and we had an incredible turnout. But first I just wanted to kind of say thank you to the people that made that happen. We had a couple of resident volunteers, Bonnie and Pamela, Barney Cornell and Pamela Penn. In home health, we had Madge and Marcella and Kathy. In the healthcare center, we had Luis and Desiree. In AL, we had Tina. I know Mike and his team helped get the room ready, and Anna helped coordinate some people. I'm sure I missed somebody. If I did, I'm sorry, but again, it was an incredible team effort to pull together. I've received a lot of cards and calls and lots of nice messages for pulling this together. Again, I think the health services team did an amazing job of getting us on the list, getting the vaccines to us. We had a really good turnout. We ended up having 299 residents get vaccinated on Monday. We had 95 staff members get vaccinated on Monday. We also had staff members get vaccinated at the pods. So staff-wise, we're about 50% vaccinated for those full and part-time staff who are eligible for the vaccine. So we're much above the national average and the state average and the average for nursing homes, but we're not where we want to be yet. We will have a second opportunity for staff members and residents to get the vaccine. We'll get more information out on that. We're hoping that that's going to be available on the February 8th date, but it may be as late as March. But again, we'll have that second opportunity for those who didn't get vaccinated on Monday. Vanna? So, just as a reminder, because I've already started getting calls of, can we start this service and that service yet? The vaccine is not effective in any of us at this point. It takes about 14 days from the first dose to get about 50% effectiveness. It's going to take another 14 days from the second dose to get to that 94% effectiveness. And again, that's not until February 22nd that we see the vaccine at its most effective rate. So no, we can't get back to normal yet. We need to continue with the same habits we've had and the same practices that we've had really over the last 10 months now to keep the campus and our Westminster Village families safe. And that really is, it's keeping our social circles small, it's doing our best to stay on campus, it's wearing our mask, us employees wearing our shield, not going out to eat, not having big family events, washing our hands, and keeping that social distancing. So we still have a ways to go before we can start getting greatly back to normal. So we'll talk a little bit more about that, but a couple of the things that aren't so good news. So we have good news, we have the vaccine on campus. We have bad news. Arizona numbers are higher than ever. Arizona has the highest per capita positivity case in the nation right now. We're seeing 8,000 plus virtually every day of new cases in Arizona and a positivity rate up to as high as 43%. So again, we gotta continue to be strong. There's also a new strain of the virus out, highly contagious. It started in Europe. We've now seen it in Colorado. I think in California confirmed as well. But there's a campus that's in our local area, in the greater Phoenix metro area, and they believe they have 45 cases, and they believe it's the new fast-spreading virus. Good news about the virus is that seems to be covered by the vaccine as well. So again, once we get to February 22nd, it shouldn't be as big of a worry, but right now it is. So if it's in the Phoenix metro area, our people are going to be exposed to it at some point. So we got to continue to stay safe. That being said, we're going to continue the partner program that we put in place about a month ago that was due to expire, I think, tomorrow. We're going to continue that to January 25th. That's basically 2 weeks after the first vaccine has been put in place. So that gives us at least that 50% effectiveness before we go back to more normal. Again, this is a program that we're asking people to do. We think it works. We know it works. It has definitely helped us from spreading the virus on campus when it's been on campus. So again, we ask you to stick to that program. Keep your social circles small. Try to not go off campus right now. Again, there's risk on campus, but there's a much greater risk in the greater Phoenix metro area. So we're going to continue the partner program until the 25th of January. Then just, I think the other thing is kind of back to where I started, which is just a huge thank you to Madge and Desiree for getting the vaccine, not just for our healthcare center, but for all of our campus. There's a number of campuses like us that were only able to get enough vaccines for their healthcare center staff and residents. We were able to make it available to every single one of our residents on campus and every single one of our staff. So Madge, Desiree, thank you very much. Also wanted to thank Elva. Elva is the one who coordinates all of the testing, tracks all of the testing, documents all of the testing, and has done a tremendous job of again, keeping us from having the spread on campus by quickly finding out where we have a positive and a case. So we have another 30 to 45 days on campus that are going to be, harder than we want them to be, but we have really 30 to 45 days before we start seeing us really opening up our services back to normal. Again, we hope sometime in the beginning of February we see at least one of the restaurants opening, if not both. Again, around February 22nd, we hope to be able to have housekeeping back in your apartments. And again, getting back to some sense of normal, but we have a little ways to go, especially with the new strain of the vaccine and the numbers going up in Arizona. Thank you very much.